Imagine a world where insects lay their eggs under your skin. It's a chilling thought, isn't it? It sounds like a scene from a horror film, right? But this is not fiction, it's a disturbing reality for some. For some unfortunate individuals, this nightmare becomes a reality thanks to the botfly. These parasitic insects are more than just a nuisance. These flies, found in tropical and subtropical regions, have a parasitic life cycle that is both fascinating and repulsive. Their presence is a stark reminder of nature's darker side. While we often marvel at the wonders of nature, the botfly serves as a stark reminder that the natural world can be as unsettling as it is beautiful. The duality of nature is truly astonishing. Botflies themselves don't directly implant their eggs on humans. They have a more insidious method. Instead, they employ a rather crafty method. They use other insects as their unwitting accomplices. Female botflies lay their eggs on other insects like mosquitoes or ticks. These insects then become carriers of the botfly's offspring. When these unsuspecting carriers bite a human, the warmth of the skin triggers the botfly eggs to hatch. It's a perfect, albeit horrifying, strategy. Tiny larvae then burrow into the skin, starting their gruesome development beneath the surface. This marks the beginning of a disturbing journey for both the host and the parasite. Once inside, the botfly larva makes itself comfortable. It feeds on the host's tissue, growing larger over time. The larva creates a breathing hole in the skin, which looks like a small, red, boil-like lesion. This allows the larva to breathe and expel waste. As disturbing as it sounds, the human body is merely a temporary home for the botfly larva. Its ultimate goal is to mature and emerge, ready to begin its own life cycle. The presence of a botfly larva under the skin is not exactly a subtle affair. It often starts with a small, seemingly harmless bump. The affected area becomes increasingly itchy and irritated. This itching can be relentless, making it hard to ignore. As the larva grows, the discomfort intensifies. The skin around the area may become more inflamed and tender to the touch. In some cases, individuals may experience a crawling sensation under their skin. This sensation can be quite disturbing and hard to ignore. This is not a figment of their imagination, it's the botfly larva moving around. The movement is a clear sign of the larva's presence. As if the discomfort wasn't enough, the sight of the breathing hole and the knowledge of a larva growing beneath the skin are deeply unsettling. This can cause significant distress. This is usually the point where people realize something is seriously wrong and seek medical attention. Prompt medical intervention is crucial to remove the larva and alleviate the symptoms. Section 4. A delicate procedure extracting the botfly larva. This process is not for the faint-hearted and requires meticulous attention to detail. Removing a botfly larva requires a steady hand and a strong stomach. The procedure is intricate and demands precision to avoid complications.
It's crucial to extract the larva intact to prevent further complications. Any rupture could lead to severe infections and prolonged healing.
Blocking the breathing hole with petroleum jelly or a similar substance is a common tactic. This method is effective in suffocating the larva.
This cuts off the larva's air supply, forcing it to try and emerge. The larva will instinctively move towards the surface in search of air.
Once the larva has partially emerged, fine-tipped forceps are used to gently pull it out. Careful handling is essential to avoid breaking the larva.
This process requires patience and precision, as any damage to the larva could release harmful bacteria into the wound. The risk of infection is high if not done correctly.
The relief upon successful extraction is palpable. Patients often feel immediate comfort and a sense of normalcy returning.
Not only is the physical discomfort gone, but the psychological relief of having the larva removed is immense. The patient can finally move on from the ordeal.
Thank you for watching. If you found this video informative, please like, share, and subscribe to our channel for more fascinating medical stories.